Congressman Gingrey, and welcome to my week in Washington for September the 21st. You know, last month, the end of July, we voted in the Energy and Commerce Committee on the Health Reform Act, the Democrat and the President's bill for reforming our health care system. As my constituents know, of course, I had great concerns about that bill, particularly the government taking over our health care, and so I voted no. Since then, of course, the President came back after the 5-week August recess where so many people, not just in my district, but across the entire country, both Republicans and Democratic districts, turned out en masse for these town hall meetings, letting their members know that they were very concerned about cutting, literally gutting Medicare, raising taxes $800 billion, and this so-called government option, which eventually would lead to a single-payer national health insurance system. Well, we had a meeting today on the Energy and Commerce Committee, and I had an opportunity to offer some suggestions based on what the President said when we came back after the August recess, and he spoke to the nation from a joint session of Congress. And basically here are just a few of the things, and it's a Obama health care test. First of all, this is the President speaking. The reforms I'm proposing would not apply to those who are here illegally. Mr. President, H.R. 3200 fails miserably on that test because there's no verification system where a person doesn't really have to identify themselves with a photo ID or a Social Security card. They sign up. Another quote from the President: nothing in the plan requires you to change what you have. Mr. President, in H.R. 3200, that fails as well, because when we cut $500 billion out of the Medicare program, some 10 million seniors are at risk of losing their coverage under Medicare Advantage. So much for this idea, if you like what you have, you get to keep it. The same thing, of course, is true for people that are insured by their company, by their employer. Some 120 million of them, eventually, even though they like what they have and they would like to keep it, they're at risk of losing it. And when the government completely takes over, everybody will be under that government plan, and it will indeed lead to rationing. The President also said during the speech, no federal dollars will be used to fund abortion. Well, in H.R. 3200, that is absolutely not a true statement. Anybody that depicts a plan that offers coverage for abortion that takes taxpayer money, if they are eligible because of low income, for subsidies, then generally the taxpayers are the ones who are paying for that abortion. And last but not least, the President during the speech said, I will not sign a plan that adds one dime to our deficits. Well, H.R. 3200 fails on that count as well. The Congressional Budget Office, nonpartisan Congressional Budget Office, whose director is picked by the majority party, indeed by the Speaker of the House, Mrs. Pelosi, and the majority leader of the Senate, Mr. Reid, says that this bill comes up short $265 billion of being paid for. So that's how much additional red ink, and that is certainly a conservative estimate. So I just want to let my constituents know that the Obama health care test fails miserably, and we can do better, and we are going to continue to try to get his attention, whether it's on medical liability reform, whether it's on health information technology, whether it's on equalizing the tax treatment so that everybody has an opportunity to get discounted health care, creation of high-risk pools, allowing people to cross state lines and purchase insurance that's cheaper than, let's say, it is in our state of Georgia. Why shouldn't they be allowed to do that? That's probably enough for this week, but I wanted to let everybody know that we are continuing to work hard, and I will continue to work hard, that we get meaningful, cost-effective health care and health insurance reform, and we can do that without breaking the bank. Thank you so much, and we'll see you next week.